Welcome everyone to today's webinar, What is Supportive Oncology? Led by Dr. Cubison, Dr. Wu, Dr. Jacobo, and Allison DiBazio. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the Supportive Oncology team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist in our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate our question and answer. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to our presenters.
Thank you so much, Sierra, and thank you all for joining us today. We're really excited to share about some really sort of groundbreaking, innovative supportive oncology programming that we have here at Dana-Farber for our patients, and we want to share more about that with you all. My name is Dr. Caroline Cubison. I'm a palliative care doctor at Dana-Farber.
Hi, my name is Dr. Carrie Wu. I'm a psychiatrist at Dana-Farber. I'm also the clinical director for collaborative care.
Hello, and I'm Dr. Michelle Jacobo. I'm a psychologist, and I'm the director of psychology and a member of the Collaborative Care Supportive Oncology Collaborative.
Hi, my name is Allison DiBiase. I'm a clinical social worker, and I'm also a social work manager here at Dana-Farber. Welcome.
So we wanted to start with just a kind of view from space of what is supportive oncology? What are we talking about as a multidisciplinary group here when we're meeting with you and your family members? And supportive oncology is a group of multidisciplinary clinicians at the Dana-Farber and in cancer centers in general, where what we are here to do is hold your whole identity while you go through your cancer treatment and experience. We focus on the emotional, we focus on the social and the practical aspects of living with cancer and how it affects your whole person. We work very closely with your medical team, and our job is to pay attention to feelings, to pay attention to how it's affecting your relationships. We make every effort to look at symptoms with you from that whole perspective. As I've said, you'll hear us say whole a lot probably today. And we're really looking at identity and helping you manage. So we may be talking about coping. We may be talking about resources. We may be talking about pain and symptoms, sadness that might become a little bit heavier and harder to move. That is really supportive oncology. We are the wraparound to the whole person and the whole family that comes with cancer care.
So, in the past, supportive oncology providers like us often really worked separately, right? So, if you needed our help, your oncologist had to send you to each one of us one by one. This process might then make it hard for you and your oncologist to know what services were available and how each of these services could be helpful to you.
Thank you, Terry. You also may have, conceptualization of what we do, such as social workers help with resources, but we do more than that. We help with providing clinical counseling to help patients and families cope with the emotional impact of having cancer.
Yeah.
Yeah.
Or, you might believe that feeling depressed is just part of having cancer. And while sadness is certainly a natural response, clinical depression is different. It's a treatable condition, and there are both behavioral and medication options that can help.
Yeah, and similarly, I think people have a lot of preconceived notions when they hear palliative care, and they may assume that palliative care is only right for people at the very end of life, when in reality, the whole goal of having palliative care support is to help you feel as well as possible, no matter where you are in your journey. And so it's historically been challenging for us to sort of meet patients earlier on, even when we know that we can really improve their experience living with cancer and going through different cancer treatments.
So what you're hearing is that because of some of these misconceptions, because sometimes it's harder to get appointments, this new pathway that we'll be describing to you really is opening up access to you and your family members to have some of this supportive oncology care that we provide. And we want to make sure that you get connected earlier and are able to get whole team access sooner and really understand what it is that we offer.
So this is really why we're so excited to share this new approach here at Dana-Farber. We're transforming the way we deliver supportive oncology care to just make it easier, more coordinated, and more complete. So you and your oncologist don't have to guess what you might need. Our goal is very simple, just to make sure that you get the right support at the right time. And so we're here to talk to you about how we're implementing this through the Supportive Oncology Collaborative. So at this point, we can show the slides.
So here you can see that we're really just reminding you who we are and that is what we're talking about today. And before we jump in, if we could go to the next slide, I want to say a little bit more about what Dr. Wu was mentioning, which is that we know with cancer and medical treatment, emotion and thought and behavior, our whole lives really are changed and are reacting to the new realities that we're facing. And we expect people to have emotional reactions. We know that that is part of what happens when your life is sort of so profoundly interrupted by this illness. So we want to start with the awareness that this is normal and expected, that this slide, though it has a linear pathway, that people move across emotions at very different times in their being treated for cancer. It's not at all unusual at initial diagnosis for us to sit with people and work and problem solve the shock and the fear and really just the general sense of overwhelm that any of us would have. We know as care is ongoing that emotions will come and go like waves. We talk about in a wave-like pattern, sadness and grief, anger, guilt, worry. These are expected. They make sense. And we create room for this as we kind of continue to live our lives and fit cancer treatment into our lives. It's true that people get a little more able to the adjustment and the coping as they're spending time with their families and with their medical teams. But there's always going to be a sense of holding uncertainty. We try to help problem solve where we can. We work a little bit on how do we tolerate the reality that we're in, even if it's not the reality we would wish for anyone. And we move again, as you can see me kind of moving through this slide, to some acknowledgement that this landscape is always shifting, right? And that there's times that we're in a place of more acceptance. There may be times where we're feeling completely again opened up and unearthed. We renew our priorities. We continue to feel both resilient and vulnerable because this is really the human experience. What we want to acknowledge, why I'm spending time on this, is that we understand this and we can hold this and we don't sort of panic and we want to make room for it. The Supportive Oncology Collaborative holds all of this with you. And each of us in our own way participates in helping you live and treat yourself and your family while you go through your care.
So, what exactly you may be asking is a supportive oncology collaborative, right? And who's in it? So this program is really designed to be a team-based care that starts with you in the center. Your care team is made up of your oncologist and a number of the specialists in supportive oncology, which includes, you can see around the circles, social work, psychiatry, psychology, palliative care, really all of us here. You might meet with just one or two of the team members, depending on your needs, right? But even if you don't meet with everybody, behind the scenes, we do meet every week to review patients to make sure that your needs are met. So that's the big change here. I will now just hand it over to Allison to explain, just how exactly works.
Thank you, Carrie. So how does this all work? What is the first step? So social work will reach out to you to schedule an appointment, whether that's in person, whether that's on the phone, whether that's on Zoom. We accommodate your needs in which you're most comfortable with. We will begin by asking questions. Who are you beyond your cancer diagnosis? So we can get to know all of you. How are you coping? How are you managing? Um, you know, what are some of your feelings? How are you navigating all of this? How are you coping physically, emotionally, spiritually, as I said? And another example of what we will want to help with as well is a lot of our patients have young children, older children, and communication around their illness can be challenging, even with friends and family. How do I share? How do I approach this? Do I at all? That's another aspect we will want to help and support you and navigate these complex situations, which are often very normal, as our team has noted. Um, and we also help with many other things. It's what you're coping and managing in the moment. We're here to support you. And so with that, I'm going to turn it over to Dr. Cubbins.
Thank you, Allison.
Yeah.
So after that initial social work assessment, which is really sort of encompassing many different aspects of your life, and like Allison mentioned, getting to know you, getting to know how you're doing sort of emotionally and socially with everything, but also how you're feeling physically. Are you having physical symptoms either from the cancer or from the treatments? Are you having side effects? Once that oncology social worker has done sort of this comprehensive assessment, we have our weekly Supportive Oncology Collaborative team meeting where the social worker will be able to share what they have gathered so far. And we'll have members of all of those other disciplines. As Dr. Wu was mentioning, we'll have psychology, psychiatry, palliative care, and social work all talking together, trying to come up, okay, what is the best treatment plan to help this person feel as well as possible from these different areas that we want to help? And we may come up with different recommendations based on that assessment. Our recommendations may involve, let's continue to support their emotional processing, or let's continue to support their coping skills development or advancing their coping skills. And does that mean maybe working more closely with the social work team? Or does that mean maybe working with someone from our psychology team? We may learn that there are communication needs that you want help with. And so we may, ask if it's okay to communicate with your oncology team to make sure that you're getting the information that feels most helpful and that we're able to convey and communicate. Also with any loved ones that you may want to be able to talk to more openly. If you are having physical or emotional symptoms that we have medications that we think might be helpful, we may say, why don't we talk with this person about X, Y, or Z medication and see if they would be interested in trying that to see if that medicine helps them with that symptom that they're having. And we may, work with your oncology team to make sure that they're also in agreement with any medication recommendations. And sometimes, it does make sense to connect you to other people in our department. So, we may say, gosh, this person really sounds like they would benefit from seeing someone from palliative care, or this person really does sound like they would benefit from meeting with a psychiatrist for an evaluation to talk about what's on their mind. In which case, we may let you know that that's been the recommendation made, and we will work to make sure that that connection happens if that's something that you're interested in.
Thank you, Carolyn. So, how do you get to us? What is the process to meet with us? So, and we are eager to meet our patients to help, as we've all stated, to navigate this complex diagnosis and treatment of cancer. In patients, when you first come in, you're overwhelmed with so much information. And always remember, ask questions. Reach out to your oncologist, reach out to your nurse. I want to speak to a social worker. I'm not sure about this. I've heard about supportive oncology. I want that team to help me through this navigation and journey. You can reach out to the social work department and ask to meet with the social worker or a caregiver or a friend with your consent, obviously. We are here to help you navigate this. And I will say one of the most exciting things I have learned and I see with this program is it gives access to everybody. And that is our ultimate goal, is we want to make sure our patients have access to us and to this program so we can help support often the most challenging time in your life, but also help you feel a sense of connection and support. Thank you, everybody.
And so that's what we wanted to share with you all today, but we are more than happy to answer any questions that may be in the audience as well.
Thank you so much, everyone. That was a wonderful presentation, and it definitely made me learn a lot and also kind of opened my eyes to everything that's going on in this collaboration. So really thank you all for taking the time. As Dr. Cubbinson mentioned, please feel free to put any questions into the chat. We'll take a few minutes to see if anyone has any. Yeah, and thank you all for joining us.
Thank you.
Do we have any questions in the chat? I can't see.
We don't have any questions in the chat or the Q&A yet. Maybe we'll give it one more minute and then
Sure.
we can sign
But
off.
one thing I would say that I think we all have been raised really believing very strongly that we don't want people to worry alone. And it's one of our guiding principles at Dana-Farber. So this collaborative really, again, it has a team, and we want to be there with you and for you and your family members. And so the bottom line is, if you're interested and you'd like to know more, please ask someone to connect you to your social worker, and know that we are here and we do not want you worrying alone.
Absolutely.
Awesome. Thank you so much. So we don't have any questions, but we did get a couple heart reactions from the audience. But thank you all for taking the time to join us.
Yeah.
And
Thank you guys for coming.
yes, thank you everyone for joining
We're
us.
here if you need us. Definitely.
Awesome. Thanks, everyone. Take care.
Thank you so
Bye.
much.
Yep.